What can be the causes of death in drowning? Can anyone answer that? Causes of death in drowning?
Asphyxia is the most.
Asphyxia, very good.
Vagal inhibition हो सकते हैं.
Innovation, yes.
Sudden cardiac arrest.
Myocardial arrest. Cardiac arrest, actually. Good, Dipendra. So you have answered almost all. So, Augie Jize Padai, what were the types of drowning? This may answer to you. Okay, so asphyxia, ventricular fibrillation, laryngeal spasm causing for the asphyxia, vagal inhibition, exhaustion, exhaustion le pani huna sakcha. And अर्को एउटा common is injuries, not just due to this regular cause of drowning, but due to if it hits the if someone hits the stone or rock, or even if a person hits the boat or a ship, or even by the aquatic animals, secondary injuries ma parcha yिनीहरु सबै. All right, so these are the causes of death in drowning. So here again, this person was attacked by the aquatic scavengers, so this called animal scavengers. Maybe drowning cause of death pani hola, but again after drowning, there were other post-mortem injuries seen here. Why do we know this as post-mortem? Because you can see the color; it's grayish in color. This is the ante-mortem injury, and this is the post-mortem injury. Very nice picture. Okay. Okay, so here again, this person was attacked by the propellant of this ship, propellant, fan, let's say. This person was mutilated. So secondary injuries were same. It's the same thing. Now, postmortem appearance of drowning. Externally, we can see wet cloth. Skin is also wet. Postmortem lividity is usually in the face, upper part of chest, lower arm. Kinola. Why do you think so?
किनभने म्याम यिनीहरु चाहिँ ह्याङ भइरा हुन्छ नि त. फ्लट भए पनि यिनीहरु चाहिँ तलतिर डाउनवर्ड फेस गरेर हुन्छ.
Downward face गर्छ. किन हुन्छ? Huh? किन हुन्छ त? Okay, so downward facing हुन्छ. एउटा चाहिँ due to inhalation of water, त्यसले गर्दाखेरि जहाँनिर weight बढी हुन्छ हैन, त्यो तलपट्टि हुन्छ. ओके, अर्को चाहिँ inhalation of gases inhalation of gases हैन, especially in case of decomposition सुरु भयो भने there is production of gases. Okay, त्यसले गर्दाखेरि पनि the face person is facing downward, अनि face मा upper part of the chest र lower arms यिनीहरुमा चाहिँ lividity धेरै जसो देखिन्छ. Okay, so this is the reason of presence of lividity in these part. And lividity कहाँ हुन्छ? जहाँनिर there is more dependent part of the body मा हुन्छ, त्यहाँनिर हुन्छ. Okay, एउटा finding भयो. अर्को finding of drowning is presence of froth or foam. Froth or foam drowning मा मात्र हुन्छ कि अरु kind of death मा पनि हुन्छ?
पोइजनिङहरुमा नि हुन्छ नि.
Very good. So poisoning ma pani huncha, common finding in poisoning is presence of froth. But again, we can differentiate between the froth of drowning and froth of poisoning. Drowning ko there is a peculiar type of froth. Kino huncha? Because as water enters into the pulmonary alveoli, alveoli ma there is exchange of water with this water with air, and this pichi there is formation of froth in this alveolar lining. Lungs ma pani there is excessive amount of froth. Okay, and this froth comes out through the mouth or nose. There is a nose butter, and the color of the froth is very white in color, एकदमै bright white in color, which may not be present in this due to poisoning ko froth may be different, the drowning ko froth चाहिँ it's white, leathery, tenacious in color. Fine type of froth is present. And if you remove that froth from the nose again, and you press the chest, again more froth comes out from the body, from the nose, nostrils. Okay, so this is one of the very, very, very important finding of ante-mortem drowning. Okay, please mark my words. This is one of the very commonly asked question. And as a medical student, as a physician, one must know areas. This is presence of froth in antemortem drowning. Postmortem drowning boy bunny. If person is killed and thrown in water, this will not occur. Okay, especially in case of wet drowning. Okay, so एउटा important finding is presence of froth. अनि फ्रथको बारेमा सबै थाहा हुनु पर्यो. मैले अहिले सुपरफिसियली भनिदिइरहेको छु. Please go back to your books and please read about what type of froth is there, what is the mechanism of formation of froth, सबै थाहा हुनु पर्यो detail. Next is cutis anserina. Cutis anserina भनेको there is appearance of goosebumps. Goosebumps हुँदाखेरि you can see there is some elevated portion of the skin, due to erection of erector pili muscles. Okay, so you can see cutis anserina, which is again one of the antemortem finding of this drowning. Drowning antemortem finding cutis anserina. Cadaveric spasm. Cadaveric spasm भनेको
Spontaneous stiffening of the voluntary muscles without following the primary flaccidity that occurs due to exhaustion, excitement, fear, and drowning.
I know. So one of the very important finding is cadaveric spasm. That is, there is some person tends to clutch on something, maybe a weed, or maybe something is held in the hand due to spasm of the voluntary muscles. One tends to save himself. So voluntary muscles activate just before that is very natural. And presence of cadaveric spasm also talks about the antemortem drowning. Okay, so 3 important findings which talks about antemortem drowning is presence of froth, cadaveric spasm, and cutis anserina. Washerwoman's hand. Washerwoman's hand भनेको, this is not antemortem finding. This can be present in postmortem drowning as well, where a person is person's hand and feet appears like a washerwoman hand. तिमीहरूले आफै पनि लुगाहरू धुँदाखेरि देखेको होला हैन, पानीमा धेरै बेर एक्सपोज भएपछि कस्तो appearance हुन्छ, हातहरू wrinkles हुन्छ हैन. That is known as washerwoman's hand. So you can see the color of the froth. If it's mixed with blood, then blood tinged froth हुन्छ. There is also exam if I put this picture, people get confused. This is the dissected part of lungs where you can see tenacious white froth out here. Don't get confused. Just remember this picture. Okay, this is one of the antemortem finding, antemortem drowning finding, important finding. This is the washerwoman's hand. You can see wrinkled hand and feet. This is washerwoman's hand. Okay, if a body is found at the bottom, then this is the appearance. Okay, you can see the tenacious froth coming out. So this is the position, common position. Now, what are the internal findings? Internal findings are ballooning of the lungs. Also, um, what is ballooning of the lungs? Lungs becomes voluminous. Emphysema aqueous देखिन्छ, which is presence of it is the edematous condition due to presence of watery frothy blood stained fluid. If the victim is unconscious, then there is flooding of lungs with water, but there is no presence of froth. So post-mortem drowning or antemortem drowning. If it's antemortem drowning, then we can see emphysema aqueous, where there is frothy blood stained froth present in the lungs. Whereas if it is a case of post-mortem drowning, or if the victim is unconscious, because there's no breathing, breathing नहुने बित्तिकै के हुन्छ, lungs may be filled with water, but there is no froth. अर्को हुन्छ एउटा plateaus hemorrhage. Plateaus hemorrhage, you can see confluent hemorrhagic spots around the lungs, patches हरूमा देखिन्छ, that this is known as plateaus hemorrhage. So presence of water in the lungs मा चाहिँ hydrostatic lungs भन्छौँ हामी, हैन. त्यो बाहेक अरु के हुन्छ, dilatation of the right side of the heart, blood is diluted, stomach contains water, brain is swollen and is flattened. Okay, these are the other common findings or internal findings of drowning. One important test is there, that is known as diatom test. I know, though you need to know about this test. I know you should be knowing about this diatom test, but this test is not done, practically not done anywhere. But again, if the case is very controversial or sensitive cases may be done, तर हाम्रो देशमा at least गरेको छैन diatom test. एकचोटि एउटा यस्तै ड्राउनिङ को एउटा सेन्सेसनल न्यूजै थियो, हाउ डु फाइन्ड आउट ड्राउनिङ, इट इज अ केस अफ एन्टिमोर्टम ड्राउनिङै हो कि होइन भनेर कसरी फाइन्ड आउट गर्यो त भनेर भन्दा दे ह्याड रेड अबाउट डायटम टेस्ट समवेयर, द मेडिकल अफिसर्स, सो दे टक्ड अबाउट डायटम टेस्ट, बट अगेन दिस इज नट प्र्याक्टिस्ड हियर, बट यस यु शुड बी नोइङ वाट दिस इज. ओके, so diatom भनेको चाहिँ it is a microscopic unicellular or colonial algae. It is an algae which is present in different region. In a different region, different type of algae is present. Okay, अब यो किन important छ भन्दाखेरि एउटा त we can find out it's a case of antemortem drowning. अर्को चाहिँ we can even find out which place the person was drowned. So particular place, particular algae is present. Okay, so when this water enters into the body, it enters from ruptured alveolar wall, it enters into lymph channel if the circulation is taking place, and it enters into the pulmonary vein, then further enters into heart, to brain, liver, bile and other viscera. And if you tend to find bone marrow diatom document, it is the surest case of antemortem drowning. Now, तिमीलाई exam मा सोध्यो भने how do you know it's a case of antemortem drowning भन्यो भने, first you have to talk about the froth, cadaveric spasm. You can talk about this goosebumps वाला के थियो, what was that name? Cutis anserina भयो. And lastly, you can talk about diatom as well, but practically, since it is not done, though it is very reliable, since it is not done, you can talk about diatom, but at the last, and you can mention that it is not regularly practiced, but it is one of the most reliable sign of antemortem drowning. So this is ballooning of the stomach, lungs, stomach. This is ballooning of the lungs. Ballooning of the lungs, okay? You can see the marks of the ribs as well. You can see, you can find water in the cranial cavity as well. Okay, water may be present here. There are certain deaths associated with this scuba diving, diving or scuba diving. Skin diving is hazards of swimming मा चाहिँ skin diving ले के कारणले हुन्छ or scuba diving भनेको scuba I'm sure you know about scuba diving, self-contained underwater breathing apparatus which is used for diving inside the water. So यसमा चाहिँ के कारणले डेथ क्यान अकर भन्दाखेरि फेलियर अफ एपारेटिस एउटा भयो, बारो ट्रमाले गर्दा हुन्छ, केजन्स डिजिज, निमोथोराक्स, इन्टेस्टाइनल एम्फाइसेमा र एम्बोलिजमले गर्दा चाहिँ डेथ क्यान टेक प्लेस. सो इट्स बेटर यु नो अबाउट दिस डेथ एसोसिएटेड विथ डाइभिङ. धेरै जसो हाम्रो सर्ट नोट्समा आइरहेको हुन्छ. Okay, so that is it about asphyxia. यहाँसम्म केही नबुझेको छ, I need to repeat भने मलाई let me know. Otherwise, we can end our class here. Next class, let's talk about transportational injuries.